Stomach ulcers are painful sores that develop in the lining of the stomach. This lining is usually protected from the strong acids that help us digest food. When this protection weakens, acid can damage the stomach lining, leading to an ulcer. Imagine a crater forming in the ground. That's similar to what an ulcer looks like in your stomach. These sores can cause a burning pain, often described as a gnawing or aching sensation in the upper abdomen. This pain can be worse when your stomach is empty, like between meals or at night. Ulcers are surprisingly common, and knowing the causes can help us prevent and treat them effectively. One of the most common causes of stomach ulcers is a bacterial infection, specifically by a bacterium called Helicobacter pylori, or H. pylori. This bacterium can inflame the stomach lining, making it vulnerable to ulcers. Another frequent culprit is the prolonged use of non-steroidal anti-inflammatory drugs, or NSAIDs, like ibuprofen and aspirin. While effective for pain relief, these medications can irritate the stomach lining over time, increasing the risk of ulcers. It's important to remember that not everyone who carries H. pylori or uses NSAIDs will develop ulcers. Our bodies have defense mechanisms, but certain factors can tip the balance, making us more susceptible. While not direct causes, stress and diet can play a role in ulcer development. Stress doesn't cause ulcers, but it can increase acid production, potentially worsening symptoms and delaying healing. Similarly, while spicy foods don't directly cause ulcers, they can irritate existing ones just like rough fabric can irritate a wound. Adopting stress-reducing techniques like exercise, meditation, or deep breathing can be beneficial. Similarly, being mindful of your diet, especially if you have an ulcer, can help manage symptoms and promote healing. Diagnosing stomach ulcers often involves a procedure called an endoscopy. A thin, flexible tube with a camera is inserted through the mouth and down into the stomach, allowing the doctor to visually examine the lining. Other tests, like breath tests for H. pylori or stool tests for blood, can provide further information. Treatment depends on the underlying cause. If H. pylori is detected, antibiotics are prescribed to eliminate the bacteria. Medications that reduce stomach acid production are commonly used to alleviate pain and promote healing. Lifestyle modifications, such as stress reduction and dietary adjustments, play a crucial role in managing symptoms and preventing recurrence.